Did you know that feelings of fatigue, lack of appetite, and even skin irritation can be related to bile deficiency? In this video, we'll reveal the 13 signs of bile deficiency that could be affecting your health. Before we start, remember this video is for information only and doesn't replace advice from a healthcare professional. If you find this video helpful, please give it a like and subscribe to our channel for more health tips. First, let's talk about bile. Bile is a fluid created by the liver, which is essential for digesting fats. Without sufficient bile, your body may have difficulty effectively processing dietary fats, which are important for the absorption of essential fat-soluble vitamins such as A, D, E, and K. When bile production is insufficient, these vitamins may not be properly absorbed, potentially leading to deficiencies and associated health problems. Moreover, bile plays a significant role in eliminating waste and toxins from your body. It helps transport these substances out of the liver and into the digestive system for excretion. When bile levels are low, this detoxification process can be compromised, allowing toxins to build up in the body, which might manifest in symptoms like fatigue, skin issues, and gastrointestinal discomfort. Understanding these roles of bile is crucial for recognizing the signs that indicate a deficiency. Let's explore these 13 signs that could suggest you might have a bile deficiency. Sign number 1. Bloating and gas are common indicators of insufficient bile production. When bile levels are low, fats remain undigested in the stomach for longer periods, causing discomfort such as bloating and excess gas. If you often experience bloating after meals, especially those with a high fat content, it could be a sign that your body is not processing fats properly due to reduced bile production. To alleviate bloating and gas associated with bile deficiency, experts recommend several dietary adjustments. Consuming smaller, more frequent meals throughout the day can ease the digestive burden on your system, allowing for more efficient fat breakdown. In addition, limiting intake of fatty foods until bile production improves can help minimize symptoms. Sign number 2. Pale stools can be a significant indicator of insufficient bile production. Bile is responsible for giving stool its characteristic brown color. When there isn't enough bile in the digestive system, stools can appear pale or even clay-colored. This change in stool color is often one of the early signs of bile deficiency. It's important to pay attention to your bathroom habits and monitor any changes in stool color. If you consistently notice pale stools, it could signal that your body isn't producing adequate bile. Experts advise that pale stools should not be ignored, as they can indicate underlying health issues related to bile production or other digestive disorders. In addition to stool color changes, other symptoms such as digestive discomfort, bloating, and difficulty digesting fatty foods may accompany bile deficiency. Sign number 3. Fatigue can be a significant consequence of inadequate bile production. Bile is crucial for breaking down dietary fats and absorbing essential fat-soluble vitamins like A and D. When your body can't digest fats properly due to low bile levels, it can lead to a deficiency in these nutrients. This deficiency, in turn, can result in feelings of tiredness, lack of energy, and overall fatigue. To combat fatigue associated with bile deficiency, it's important to focus on a balanced diet rich in nutrients that support bile production and fat digestion. Including foods high in healthy fats such as avocados, nuts, seeds, and fatty fish can help stimulate bile production and aid in fat absorption. Avoiding large, heavy meals, especially those rich in unhealthy fats, can reduce the strain on the digestive system and ease the feeling of fatigue. Sign number 4. Skin irritation can often be linked to a bile deficiency. Bile plays a key role in eliminating toxins from the body. When bile production is insufficient, toxins can accumulate in the bloodstream, potentially leading to irritated and itchy skin. This buildup of toxins can also overload the liver, impairing its ability to detoxify effectively, which can further contribute to skin problems. Recognizing skin irritation as a possible symptom of bile deficiency is very important for early intervention and treatment. Drinking plenty of water throughout the day helps flush out toxins and supports general detoxification processes. In addition, adopting a balanced diet that includes foods known to promote bile production, such as beet, artichokes, and leafy greens, can help support digestive health and alleviate these symptoms. Sign number 5. Bad breath can be a consequence of inadequate bile production. When your body struggles to digest fats due to insufficient bile, undigested fats can ferment in the stomach and produce unpleasant odors that contribute to bad breath. This is because the breakdown of fats is not completed properly, leading to the release of gases and compounds that can cause oral odor problems. Sign number 6. Yellowing of the eyes and skin, known as jaundice, is a clear indicator of impaired bile flow and elevated bilirubin levels in the body. Bilirubin is a yellow pigment produced during the breakdown of red blood cells, and normally, bile helps eliminate excess bilirubin from the bloodstream. When bile flow is hindered or bile production is insufficient, bilirubin builds up, causing the skin and whites of the eyes to turn yellow. Sign number 7. Difficulty losing weight can often be attributed to insufficient bile production. Bile plays an important role in the digestion and absorption of dietary fats. When bile levels are low, the body has difficulty breaking down fats efficiently, which can lead to difficulty using fat reserves for energy. This inefficiency can contribute to difficulties in losing weight, even with efforts in terms of diet and exercise. Experts suggest that addressing bile deficiency is essential to support weight management efforts. Without adequate bile, fats may not be properly absorbed, leading to nutrient deficiencies and potential imbalances in energy metabolism. Sign number 8. Nausea and vomiting can be symptomatic of inadequate bile production and impaired fat digestion. Bile helps break down fats into smaller molecules that can be absorbed by the body. When bile levels are insufficient, fats may remain undigested in the stomach, causing discomfort and triggering nausea and vomiting in some individuals. This is because the digestive system has difficulty processing fats efficiently, which leads to a feeling of nausea and upset stomach. Experts emphasize that these symptoms can also be indicative of other underlying conditions affecting the gallbladder or liver, which require medical attention. Monitoring dietary habits and symptoms can provide valuable insights into the effectiveness of fat digestion and bile production. To alleviate nausea and vomiting associated with bile deficiency, it recommends several dietary and lifestyle adjustments. Eating smaller, more frequent meals throughout the day can help ease the digestive workload and reduce the feeling nauseous after eating. Sign number 9. Brittle nails and hair can indicate a deficiency in bile, which is essential for the absorption of fat-soluble vitamins crucial for nail and hair health, including vitamins E and K. When bile production is inadequate, the body may struggle to absorb these vitamins efficiently, leading to weakened nails that are prone to breaking and hair that becomes dry, brittle, and more susceptible to damage. Experts point out that insufficient bile can disrupt the absorption of essential nutrients, affecting not only nail and hair health, but also general immune function and skin. Sign number 10. Frequent diarrhea can be a consequence of insufficient bile production, which normally helps in the digestion and absorption of fats. Bile emulsifies fats in the small intestine, aiding in the formation of solid stools. When bile levels are low, fats may not be properly digested and absorbed, leading to increased water content in the stools and resulting in loose, watery diarrhea. Bile deficiency can disrupt the normal digestion process, affecting the consistency and frequency of bowel movements. Sign number 11. Hormonal imbalances can be linked to inadequate bile production, which plays an important role in the processing and metabolism of hormones in the body. Bile helps transport hormones and facilitates their breakdown and elimination. When bile levels are insufficient, hormonal imbalances can occur, potentially leading to issues such as mood swings, irregular menstrual cycles, and other hormonal disruptions. Sign number 12. Vitamin deficiencies can result from insufficient bile production, which is essential for the absorption of fat-soluble vitamins. These vitamins play critical roles in various bodily functions, including immune function, bone health, vision, and blood clotting. When bile levels are low, the body may struggle to absorb these vitamins from the diet, leading to deficiencies that can impact overall health. Bile deficiency can impair the absorption of fat-soluble vitamins, even if they are consumed through a balanced diet or supplements. Sign number 13. Heartburn can be a consequence of inadequate bile production, which normally helps to neutralize stomach acid and facilitate proper digestion. Bile aids in the emulsification of fats, which allows them to be digested more efficiently. When bile levels are low, fats may not be properly broken down, leading to an imbalance in stomach acidity that can contribute to acid reflux and heartburn. And finally, poor appetite. It can often be linked to inadequate bile production, which is essential for the digestion and absorption of dietary fats. Bile helps emulsify fats in the digestive tract, allowing for their efficient breakdown and absorption of essential nutrients. When bile levels are insufficient, the body may struggle to digest fats properly, leading to digestive discomfort and a decreased desire to eat. So there you have it, 13 strange signs of a bile deficiency. If you notice any of these signs, it might be worth looking into ways to boost your bile production. Now that we've explored the symptoms of bile deficiency, let's discuss practical tips on how to treat and manage it through good habits. Healthy diet. Include a variety of foods that stimulate bile production, such as beets, artichokes, and leafy greens. These vegetables contain compounds that support liver function and bile flow. Incorporate moderate amounts of healthy fats, like olive oil and coconut oil, into your diet. These fats can help stimulate bile secretion without overwhelming the digestive system. Consider adding bitter herbs and foods like dandelion greens, arugula, and bitter melon to your meals. Bitter foods stimulate bile production and aid in fat digestion. Incorporate plenty of fiber-rich foods such as fruits, vegetables, and whole grains into your daily meals. Fiber helps promote regular bowel movements and supports digestive health, which is important for managing bile deficiency symptoms like bloating and diarrhea. Focus on consuming soluble fiber sources such as oats, flax seeds, apples, and psyllium husk. Soluble fiber forms a gel-like consistency in the digestive tract, which can help regulate bowel movements and promote overall digestive health. Be mindful of increasing fiber intake gradually, and drink plenty of water throughout the day to prevent constipation and support the movement of fiber through the digestive system. Stay hydrated. Drink sufficient water during the day to maintain hydration and support bile flow. Water helps dilute bile and aids in the digestion and absorption of nutrients. Consider incorporating herbal teas like peppermint, ginger, or chamomile into your routine. These teas can promote digestion, reduce inflammation, and soothe the digestive tract. Avoid trigger foods. Limit or avoid foods that can exacerbate symptoms of bile deficiency, such as high-fat foods, spicy foods, caffeine, and alcohol. These substances can put additional strain on the digestive system and worsen symptoms like heartburn and nausea. High-fat foods require more bile for proper digestion. When bile production or flow is impaired, consuming excessive amounts of fat can overwhelm the digestive system, leading to symptoms such as bloating, gas, and diarrhea. Eat smaller, frequent meals. Opt for smaller, more frequent meals rather than large, heavy meals. This approach can help reduce the burden on your digestive system and alleviate symptoms like bloating, gas, and indigestion. Practice mindful eating by chewing your food thoroughly and eating slowly. This aids in the initial stages of digestion and helps reduce the workload on your digestive system. Avoid eating large meals late at night, as this can increase the likelihood of digestive discomfort and acid reflux. Aim to have your last meal at least 2 to 3 hours before bedtime. Manage stress. Incorporate stress-reducing activities such as yoga, meditation, deep breathing exercises, or spending time in nature. Chronic stress can impair digestive function and exacerbate symptoms of bile deficiency. Prioritize regular physical activity, as exercise can help reduce stress levels, improve digestion, and promote overall well-being. Regular physical activity helps maintain optimal health and well-being, especially in the context of promoting digestive health and managing bile deficiency. Consult with a healthcare professional. If you experience persistent or severe symptoms of bile deficiency, despite these lifestyle changes, consult with a healthcare professional for proper diagnosis and personalized treatment recommendations. They can conduct tests to assess bile levels and recommend medications or supplements if necessary. By incorporating these practical tips into your daily routine, you can effectively manage bile deficiency and promote better digestive health. Remember, small changes can make a big difference over time. If you found this information helpful, Don't forget to like and share this video with others who may benefit. Stay tuned for our upcoming video on the main symptoms of a fatty liver, where we'll explore another important aspect of liver health. Thanks for watching. If you found this video helpful, please like, subscribe, and hit the bell icon so you never miss an update. See you next time.